Hi everyone, welcome back to Learn with MedNuggets. In this video, we are going to talk about statins. So what are statins? Statins are medications that are used to lower blood cholesterol levels. Statins work by inhibiting the enzyme HMG-CoA reductase. What is HMG-CoA reductase? It's an enzyme in the liver that makes cholesterol from HMG-CoA. Therefore, by inhibiting this enzyme, we can lower the amount of cholesterol in our blood. Some examples of statins are atorvastatin, rosuvastatin, simvastatin, fluvastatin, and pravastatin. Statin medications are very easy to recognize as they all contain the suffix statin. Statins can decrease the total cholesterol level, triglyceride level, and the bad cholesterol in our body, which is also known as low-density lipoprotein, LDL. Statins increase the good cholesterol in our body, which is also called high-density lipoprotein, or HDL. If you're having trouble remembering whether HDL or LDL is the good cholesterol in our body, remember HDL, which stands for high-density lipoprotein, is the type of cholesterol that we need to keep high as it's the good cholesterol. Whereas low-density lipoprotein is what we need to keep low in our body as it's the bad cholesterol. Statins can be used to prevent cardiovascular diseases and stroke, which are caused by cholesterol building up and blocking the arteries supplying blood to the heart and the brain. So when should you prescribe statins? Statins can be prescribed to people with established atherosclerotic cardiovascular disease like acute coronary syndrome, angina, people with coronary artery bypass grafts, people with a history of cerebrovascular accidents such as stroke, transient ischemic attacks, and peripheral arterial disease. High-intensity statins can be used to treat people who are less than or equal to 75 years of age. And moderate-intensity statins can be used in people who are greater than 75 years of age. Statins can also be used in primary prevention of atherosclerotic cardiovascular disease. We usually give a high-intensity statin to people with LDL levels greater than 190. To people who are greater than or equal to 40 years with diabetes who have a 10-year atherosclerotic cardiovascular disease risk of more than or equal to 20%, a high-intensity statin can be prescribed. To those with a risk of less than 20%, we can give a moderate-intensity statin. And to patients with a risk greater than 7.5 to 10%, we can give a moderate or high-intensity statin. So what are the moderate and high-intensity statins? High-intensity statins are atorvastatin 40 to 80 mg and rosuvastatin 20 to 40 mg. All the other statins other than these two are moderate and low-intensity statins. The American Heart Association recently developed a new cardiovascular risk predictor called PREVENT for predicting risk of cardiovascular events, which, unlike the 2013 calculator, includes BMI and parameters used to measure kidney function, such as GFR, urine albumin to creatinine ratio, and glycosylated hemoglobin. If you're interested in learning more about this new cardiovascular risk calculator, you can click on the links in the description box below. So now let's move on to the side effects of statins. The side effects of statins can easily be remembered with the mnemonic Lipitor, which is the brand name of atorvastatin. Statins are hepatotoxic. They can increase the blood sugar level and predispose you to conditions such as type 2 diabetes. Myalgia is muscle pain. A 2018 study reported myalgia as the most common symptom and a frequent cause of statin discontinuation in patients. Statins can also cause memory problems, fatigue, and non-specific symptoms like headaches and nausea, and a devastating condition called rhabdomyolysis. Myo is muscle. Lysis is breakdown. Rhabdomyolysis is a condition that results from breakdown of muscles. Breakdown of muscles can cause pain, tenderness, and malaise. It can also increase serum creatinine kinase. Creatinine kinase is an enzyme that's found in your skeletal muscle. When your muscle tissue gets damaged, this enzyme can leak into your bloodstream and cause an increase in the serum creatinine kinase level. Similarly, your muscles contain a compound called myoglobin. Globin is protein. Myo is muscle. Myoglobin is a red, iron-containing protein pigment in muscles that is similar to hemoglobin. It binds to oxygen and stores oxygen in the muscle. Myoglobin supplies oxygen to the cells in your muscles when needed. Breakdown of muscles can release this pigment into the bloodstream, where it will get filtered by the kidneys, causing myoglobinuria. The excess myoglobin can accumulate in the kidney tubules and cause acute kidney injury by 3 ways. Number 1, it can obstruct the kidney tubules. Number 2, myoglobin is cytotoxic. Therefore, it can damage the cells lining the walls of the kidneys. Number 3, it can cause vasoconstriction. When muscles are injured, extracellular fluid moves into the injured muscles. Less fluid in the body can lead to hypotension, which induces renal vasoconstriction to preserve fluid in the body. Vasoconstriction can decrease renal perfusion and cause ischemia and injury to the kidneys. With that said, so what's the best time to take statins? It's better to take statins at night as our body produces cholesterol overnight. However, you can choose to take it anytime as long as you take it at around the same time every day. Now let's move to the contraindications of statin use. Statins are contraindicated in pregnant patients, in breastfeeding mothers, in people who drink a lot of alcohol, in people with muscle disorders like myasthenia gravis, and in patients with liver diseases. So that brings us to the end of today's video. Hope you all learned something from today's video. Thanks for watching. Have a great day.